Hey guys, it is Shelby, and we are going to go over chapter 9, which is skin. There was no PowerPoint with this one, so I am just going to have y'all look at the sloth whenever you get stressed out and this read along with me. So, also with these health assessment things, the point is for you to grab out your book and just follow along. Okay. So we got anatomy of um, of the skin. We got the epidermis, the dermis, the hypodermis. We got hairs, nails. We have the peroneum, which is the cuticle. Um, we have the lanula, which is the white part. Eccrine, sweat glands are all over our body, so eccrine everywhere, E-E. Apocrine sweat glands, I think, apo, armpit, so those are like our armpits, nipples, areola, um, the really sweaty, oniony ones. And then sebaceous, that's where in the skin and hair for lubrication, I oversecrete sebaceous glands. In my sebaceous glands because I have a lot of sebum, and that's what you call oily skin. Okay, moving on. Questions to ask. Any changes in how you feel or look? Chronic illnesses, medications. What work do you do? Are you exposed to any chemicals? Um, any family history with skin problems? Any history with your skin problems? What do you do to keep your skin healthy? Um, is there itching on the skin? Puritis is itchy skin. What makes it worse? What makes it better? Have you tried treating it? What relieves it? Medications. Are you on any medications? Dry or sensitive or oily skin? Um, does the rash itch or burn? Do you have any allergies? What type of pain you're experiencing? Does it stay on the surface or is it more internal? Is it sharp, achy, dull, burning, itching? What makes it better? What makes it worse? Have you noticed any lesions? Differences of your mole's shape, texture, tenderness, bleeding, itching? Um, is there changes in your color of skin? Yellowish tone, pale? Is it redness? Both feet or just one? Bruising, patches, and just know that ecchymosis is another name for a bruise. Skin texture are you noticing it gain thin, more fragile, more dry? Um, is it excessively dry? So exorosis. Is it oily? Subhoria is oily. Exorosis is dry. Do you have wounds? Where is it? How long? What caused it? What have you done to treat it? Problems with wound healing? Have you seen changes in your hair suddenly or gradually? Is it contributed with stress, fever, other illnesses, or is there itching? What's your diet been like? Have you noticed any hair growth on your arms and legs? Nails, are there any problems, changes? Chemicals at home or work that you're handling? Are they more brittle? Are they pitting? Do you chew your nails? Is it difficulty keeping them clean? Okay. So now we're going to go into a little portion of skin cancer. Um, Skin cancer, there's the melanoma, sarcoma, carcinoma. The goals to keep away skin cancer is covering from the sun, so wearing long sleeve clothes, applying sunscreen, wearing sunglasses, seeking shade, and avoiding sunbathing or indoor tanning. You're going to want to use A, B, C, D, E, F for looking at the skin. So A is asymmetry, B is border, C is changes, D is is, oh my goodness, I forgot. Oh, okay. Starting over, A is asymmetry, B is border, C is color, D is diameter, E is elevation, and F is feeling. All right, so, yep, inspect skin for general color. Hypopigmentation could be a sign of albinism, so paler. Hyperpigmentation is increased melanin, and it could be associated with like Addison's disease or liver disease. Um, yep, just yep. Check the skin. Okay. Pigmented moles. Everyone usually has about 10 to 40 moles. There are these occur naturally, so you shouldn't be super scared about moles. It, there's many variations in pigmentation, even tattoos, freckles, patches, striae which are stretch marks. Melanoma is hard to catch because sometimes it looks like a normal mole. Vitiligo is really cool. Vitiligo is like patches. You got white areas and brown areas. Um, I went over A, B, C, D, E, F, G, or A, B, C, D, E, F. Coining, with this, be careful. There are some cultural practices such as coining, which is rubbing a coin over bony prominences. It will give like a bruise-like appearance, but don't mistaken it for abuse or mistreatment. That is just part of their culture. Same with cupping. Cupping is used. We've seen it in the Olympic swimmers where doing cupping, it looks like a big fat circular bruise. But that is just some people's way of relieving aches, arthritis, and any other issues that they may have. For skin, you want to check the texture, the temperature, the moisture, the mobility, and turgor. Cool skin is hypothermia, hot skin is hyperthermia. Hot skin could be due to sunburn or hypothyroidism. Cool skin could be poor perfusion. So I particularly have really cold hands, and I have a symptom called Raynaud's disease. And so that's when I have really poor circulation in my hands. So my hands are really cold all the time, and they even get achy because I have poor circulation, and they turn blue sometimes. Um, Diaphoresis is excess sweating, could be caused to pain, shock, anxiety, or hyperthyroidism again. Edema is caused with excessive scarring, and it's just a built up of uh, fluids in the tissue. And turgor is when you pull the skin up and it tense, meaning that it's dehydrated. So, like I was saying, I have Raynaud's, which is poor circulation to hands and feet. And so, since I'm not getting circulation there, I'm not getting a lot of water and nutrients in my hands and feet. I'm getting some, but not what's needed. And so I actually have really poor skin turgor. My skin will tint. And yeah, so I have to drink lots and lots of water to just get rid of my turgor tinting because that's a sign of dehydration. Check the thickness, inspect the scalp, texture, quantity of hair and color, inspect facial hair, body hair, distribution. Check the nails, the shape, the contour, the consistency, the cleanness. Um, dull, brittle hair could be sign of hypothyroidism. Um, hyperthyroidism makes hair texture fine. Parasitic infection causes could be nits and lice in the hair. Alopecia is loss of hair. Watch a YouTube video on it. There's many YouTube videos of girls discussing it, and it's very, very sad. Hirsutism is when women start developing hair in male regions. So, yeah. Um, so with nails, know that nails are going to normally have onychia at the end of it. So coil coilonchia is spoon nail, which is a sign of anemia or maybe congenital. We have leukoonchia, which is like the white stripes on your nails. We have clubbing, which could be a sign of chronic respiratory and cardiovascular disease. And they exceed 180 degrees. Bose lines, there's a groove and depression in the nail, where you kind of have to just wait for it to grow out and pitting. That's due to stress too. And pitting of the nail could be associated with psoriasis. Okay, check the thickness of the nail if it's uniform. Inspect skin lesions. We don't want that. Brittleness of the nails may be associated with poor perfusion. Know your shapes of looking at skin problems. So round oval is like a circle. Annular is round with a clear center. Iris, it looks like it has like a ring of pink, a ring of purple, and then a clear spot in the inner. So it really does look like an iris. Gyri is a snake-like appearance, and those are all shapes. Moving on to patterns, we have singular or discrete, so it's just one lesion. We have grouped or clustered, which is multiple together, multiple lesions bunched together. Polycyclic is annular lesions bunched together. Okay, so confluent is it's in one region, so it's like a cluster of them. So this is patterns still. So confluent is just like a cluster of them, a large cluster though. And linear is in a line. Zoostiform is when it's following a nerve, and generalized is when it's just all over the body. Primary lesions, okay, are like moles, freckles, patches, acne. Can use a wood lamp to detect if there's any fungal infections. Secondary lesions are, again, expected variations in the skin, like scars. Okay. If you get a fluorescent light to see fungal infection, the shine of yellow green or blue green could be indicate presence of fungi. Okay. You should note like abnormal scarring. So like if it's on the arms and stuff, it could be IV abuse. Hematoma is a leakage of blood in a confined space by a break in the blood vessel. Okay. Notice lesions, the location, distribution, color, pattern, edges, size, and characteristics. Tingliastia is those small, fine blood vessels by around the nose. Cherry angiomia is like a little red dot on the face, neck, and trunk of body. A macule is less than 1 centimeter, and that's basically a freckle. It's flat. Papule is elevated. It's less than 1 centimeter, and this is like a wart. A patch is more than 1 centimeter, and it's flat. And this is like vitiligo spots or wine stains. A plaque is elevated greater than 1 centimeter, and it's normally with psoriasis, eczema, keratosis. A wheal is like a bug bite. A nodule is a firm um, lesion that's deeper in the dermis. That's normally 1 to 2 centimeters. So this is like lipomas, hemangiomas, neurofibroma. A tumor is greater than 2 centimeters. It's elevated, solid lesion. So neoplasma, lipoma, hemangioma. A vesicle is less than 1 centimeter dilated, and this is like the little pustule bumps that you see. I don't know why I call them pustule. They're not pustules, but they're like little fluid-filled bumps that you see with impetigo, hand, foot, and mouth, varicella. A bulla is a blister. It's greater than 1 centimeter. A pustule is a pimple. A cyst is a big sebaceous cyst that's deep and yep. A scale is just flakiness of the skin. Lichenification is like leathery skin. Yeah, that's where you get like psoriasis coming in. Keloid is overgrowth of a scar. A scar is just a healing wound, a thick fibrous tissue from the wound healing. Excoriation is an abrasion or scratch. Fissure is like a crack. I get these on the back of my feet when they get really dry. Crust is like the drainage of blood or pus that dries out. So, say you have it's like a scab. So crust is like a scab. Erosion is a loss of the epidermis. So you see this with varicella, herpes simplex. An ulcer is loss of epidermis and dermis, and it concaves. You see this with syphilis, pressure ulcers. Petechia is the little red dots everywhere. They're less than 0.5 centimeters in diameter, and it could be caused by infection or intravascular defects. Purpura is a flat reddish purple mark. It's greater than 0.5 centimeters, and it's caused by infection or bleeding disorders. You see these guys a lot on older people. Ecchymosis is a bruise. Angioma is a benign mass of blood vessels. So there's sometimes babies can have this, and they call it a kiss from an angel. Capillary hemangioma is like it's basically like vitiligo, but rather than it being like brown, it's red, and it's due to like a whole bunch of capillaries. The cause is congenital vascular malformation or a stork bite. So my son actually has these on the back of his head. He has a little stork bite on the back of his neck, which normally is where little kids have stork bites. Tingliastia, again, is the little fine capillaries and small blood vessels that are prominent through the skin. Now, a spider vein it's like a big center, and it literally looks like a spider. Venus star is a thick, like it's like thick superficial veins that you can really see through. All right, for assessing infant skin, look at erythema, diaper rash, rashes associated with allergens. For adults, adolescents, you're normally looking for acne and skin lesions. For older adults, you're looking at hair, sun-exposed areas for skin cancer. So patients with immobility, so they have to be in like a wheelchair, they are more susceptible to pressure ulcers. They're at high risk because they can't get off of certain prominence of their body, so they have to shift if they're sitting a lot. Stage 1 is prolonged redness and with unbroken skin. So stage 1 is redness. Stage 2 is thickness in skin, and it appears shallow, as a shallow open ulcer in the wound bed of sloth. So I would say stage 2 is more of a kind of erosion, you know? So rather than an actual ulcer, it kind of looks like an erosion. Stage 3 involves full thickness, loss and damage of subcutaneous tissue with no bone and tendon exposed. So that is where you get really deep muscle tissue loss, or I mean just skin loss. And stage 4 is such full thickness loss, tissue loss, that you're now seeing bone, skin, muscle, or you're now seeing bone, muscle, tendon. Makes sense? So stage 1 is redness, stage 2 is erosion, stage 3 is more of like an ulcer, you're getting a lot of that skin gone. And stage 4 is like where the skin is pretty much completely gone to now you're seeing muscle and bone. And unstageable is when it gets so bad that it's covered in eschar, and yeah. A corn is on the skin is hyperkeratosis, and that's basically like a callus. Uh, Dermatitis is there's so many dermatitises, but it's superficial inflammatory, or yeah, superficial inflammatory conditions on the skin. So atopic is chronic superficial inflammation. So atopic dermatitis, it can be hay fever, asthma. You get red, weeping, crusted appearances. Okay. Intense pruritus. Contact dermatitis is an inflammatory reaction when you come in contact with an irritant or allergen. Seborrheic dermatitis is chronic inflammation of the skin that's unknown. You'll have periods of remission and exacerbation. It's like white, scaly, yellowish plaques. Yeah. Stasis dermatitis is inflammation on the lower legs. So you get edema, poor perfusion, arrhythmia. So I actually have had to deal with a patient who did have this. It is in the lower legs, and they get such swelling from edema that now you're getting redness. Okay, so stasis is normally edema related. Psoriasis is a chronic skin disorder from inflammatory cytokines that help helper T cells cause lesions of psoriasis. So the T cells are causing this because of inflammatory cytokines. And Kim Kardashian actually has this. Pityriasis rosacea is a common acute inflammatory disease in young adults. You would get like a Harold patch. Yeah, macular lesions, erythematous, pale. I actually had one of these on the inner parts of my so like in the crevice of my elbow. I had those. Warts is caused by HPV. There's 60 different types of HPV. They can be like gray, yellow, brownish on hands, elbows, knees, sole foot. Herpes simplex, chronic non-curable, painful, contagious. You get cold sores. Herpes simplex type 2 is on the genitalia, and you get vesicles, pustules, encrusting. That lasts typically around 2 weeks. So type 1 is like in the mouth, type 2 is on the genitalia. Herpes varicella is chickenpox. It spreads through droplet. Yeah, and you get on the face, just papules and then vesicles that become crust. Um, Usually after 6 days, the lesions erupt. Herpes zoster, so shingles is basically you'll see it normally on a nerve line, a dermatome, and this follows the initial varicella infection, and it's very painful, unilateral for several days. Tinea infection. So we have these are fungal infections. We have Tinea corporis, which is ringworm. We have Tinea curis, which is in the groin area. We have Tinea capatis, which is on the scalp, and Tinea pedis, which is athlete's foot. Candida. Candida is an infection caused by Candida albicans. It's commonly found in vagina, the GI tract. Cushing syndrome, diabetes, immunosuppressed are and antibiotic treatments, heavy antibiotic treatments can cause this. You'll have like loose scales, itching in the genitalia and the inguinal folds. Okay. Cellulitis is acute streptococcal staphylococcal infection of the skin and subcutaneous tissue. Involves any area on the body. So it's a strep or staph infection on the body. Impetigo. Impetigo is streptococcus bacterial infection. Um, it's common in children. You'll get vesicles, bullas. I'm not too sure how this one impetigo differs from hand, foot, and mouth disease, but they go pretty much hand in hand. Because you get these symptoms with hand, foot, and mouth disease, and my son has had it, and it's like, oh my gosh, it was awful. It's literally blisters everywhere on his hands, feet, and mouth. Glad we're past that though. Folliculitis is inflammation of hair follicles. Okay. Furnicle or abscess is a boil. So very hot. It's just like a big, big pimple. Scabies is when mites burrow and lay eggs in your skin and poop in your skin, and it's very itchy, so severe pruritus. And yeah, Lyme's disease is caused by Boreal Burgdorferi, and it's very common in the northeast states. And you'll get a rash with a central clearing. So it's known for its bullseye mark. And this isn't good. getting Lyme's disease is awful. Yeah. Spider bites. We want to be aware of black widows and brown recluses. Black widows can cause erythema, and they have two puncta from where it was bitten. Brown recluse can actually cause necrotic ulcers, purpura, arrhythmia, fever, nausea, and vomiting. Brown recluse is pretty severe. Now, malignant neoplasmas, we have basal cell carcinoma, which is the most common form of skin cancer. It increases with age, has rolled borders, depressed center, and is pigmented. These guys have had repeated exposure to sun or in these areas, I believe. Squamous cell is the second most frequent. It's result of excessive light exposure. Red hair, freckled people get these often, and it has a sharp, dictated border, and it's soft, mobile, and slightly elevated. Ulcer may form or with surrounding the redness. Melanoma is the most serious, and it can cause skin cancer related deaths. So this you want to use A, B, C, D, E, F, asymmetry, border, irregularity, color, diameter, elevation, and feeling. And yeah, these ones are bad. Yeah. This lesion may be flaky, scaly, brown, pink to purple, or have mixed pigmentation. Kaposi sarcoma is seen in AIDS, and it can have be developing connective tissues such as cartilage, bone, fat, muscle, blood vessels, or fibrous tissues. Or it could be drug-induced immunosuppression. They have like these dark purple macules, papules, and nodules and plaques on their lower extremities. It may spread all over the body, even the arms, neck, face, in oral mucosa. It has pain and itching. Skin lesions caused by abuse. Ecchymosis is a bruise, discoloration that lasts for 3 to 6 days. Bites, if you see a bite that's always intentional, that's a sign of abuse. And in children, you especially want to look in the genitalia area, in the buttocks, because in the book that's where it says bite marks are frequently located, which is very, very sad. Burns. So there's glove or stocking burn where one is immersed in scalding hot water and they get either like a stocking burn or a burn that looks like mittens. This is a sign of severe abuse too. Or there's a contact burn such as cigarette, light bulb, lighter, brands. Okay. Now we have hair, pediculosis, lice. You have it, corporis in the hair, the body hair, the scalp, and pediculosis pubis is in the genitalia area, and it can be nits or the actual lice themselves. Ew. Alopecia areata is a autoimmune disorder that causes you to lose your hair or lose fragments of your hair, and then it will grow back within like 3 to 4 months. So you'll get like these spots of bald spots. Hirsutism is increased growth of body, facial hair, or pubic hair in women. So these could be caused by endocrine disorders, PCOS, menopause, taking medications like corticosteroids, androgenic therapy. Yeah, you'll get increased hair growth. And virilization is when you get secondary male characteristics with the male hair growth patterns. So hirsutism is just dealing with hair. Virulism is when you're getting the characteristics and hair. Ankylosis is fungal infection of the nail plate by Tinea unguium. It turns yellow. And hyperkeratotic, the nail bed separates and the nail plate begins to crumble. Perionychia involves acute infection by staph, strep, or candida. It's very painful. An abscess may form. Inflammation may develop. Yeah. Perionychia. Ingrown toenail. That was my mom. Ingrown toenail is when peronchia. I'm sorry, it's peronchia, not perionychia. Peronchia. Peronchia, yeah. Ingrown toenail is when the lateral fold of your toenail grows into your nail bed, and it hurts. It can be cutting your nail down too far, wearing too tight of shoes, injury. You get pain, redness, edema, drainage. Yeah, I actually had one of these when I was in 4th grade, and it got so bad that I ended up getting a staph infection from it. So you got to take care of these quickly. And then chronic perionychia. So perionychia is like you get inflammation around the cuticle. Okay, and that's it for this chapter. Yay! Hope you guys like my sloth friend.